This is the Standing Up to POTS podcast.
Hello, fellow POTS patients and super duper people who care about POTS patients. I'm Jill Brook, and today we are hearing from POTS specialist, Dr. David Saperstein. He is a neurologist at the Center for Complex Neurology in Phoenix, Arizona. He is board certified in neurology, neuromuscular medicine, clinical neurophysiology, and electrodiagnostic medicine. He is also a clinical associate professor of neurology at the University of Arizona College of Medicine. He is a veteran of the U.S. Air Force. He attended the Boston University School of Medicine. He has so many impressive qualifications related to neurology that I can't read them all or it would take all hour, but he holds numerous professional memberships, sits on numerous national advisory committees, and was the 2021 recipient of a Community Choice Award from the Ehlers-Danlos Society. Dr. Saperstein has cared for over 2,500 patients with EDS, POTS, and related conditions, including the toughest comorbidities like craniocervical instability, Chiari malformation, and things like that. And I could go on, but I know that you are dying to hear from Dr. Saperstein yourselves. So thank you so much for joining us today, Dr. Saperstein.
Oh, my pleasure. Thank you, Jill.
So how did you become an expert in POTS? Because they don't really focus on that too much in medical school, right?
No, they sure don't. So I was a resident in neurology when Mayo Clinic first had the POTS paper. And so even as a resident, I was interested in autonomic disorders, and we didn't have sophisticated equipment. I remember once having a patient in the hospital and I was running like a little EKG strip. So I was doing, one of the tests for autonomic is looking at variations in their EKG with heart rate. And I was like printing it out and measuring, and I was just such a little geek doing my little testing. And then I went on and trained in neuromuscular medicine. And certainly now there have been for a while, autonomic specialists, but for some reason, I'm not really sure why, a lot of these people who dealt with autonomic disorders were neuromuscular specialists. And probably most of neuromuscular specialists kind of did it either begrudgingly or reluctantly. And then obviously there were people who specialized in it. And so I had always been interested. And then when working with small fiber neuropathy, which I think we'll talk about more later, which became a significant part of my practice, I realized that a lot of those patients had autonomic disorders and specifically POTS. And so I started doing more of it, and at my practice got, I guess it was a nice transition, got the state-of-the-art elaborate autonomic testing coming far from my little printing out strips of EKG and measuring them with the ruler days. And then in doing that, we're seeing more and more POTS patients and certainly seeing the connections between small fiber neuropathy and hypermobility and some of the other comorbidities, which again, I'm also sure we'll be talking more about.